Welcome to Birds.Bees.Bodies, a Planned Parenthood of Southeast and North Florida podcast where we break barriers, tear down stigmas, and promote open discussions on sexual and reproductive health. Get the buzz on topics from puberty to menopause, contraception to conception. No topic is off limits. So sit back, relax, and let's dive into a judgment-free zone to promote sexual wellness.
All right. So welcome to the first podcast for Birds, Bees, and Bodies, brought to you by Planned Parenthood of Southeast and North Florida. We're really excited to be able to launch this podcast. My name is Michelle Quesada. I am the VP of Communications for Planned Parenthood of Southeast and North Florida. And we are going to be talking today about the buzz on birth control. And we have some incredible guests with us, staff members and light students for Planned Parenthood. And we'll start with introducing Rachel, who is a doctor of nurse practice at our affiliate.
Good morning. My name is Rachel. It's a pleasure to be here. It's nice to meet you all. And I look forward to jumping into the topics and answering whatever questions or concerns you have today.
Wonderful. We also have Summer, who is a community health educator with our education program at Planned Parenthood. Hi, Summer.
Hi, I'm excited to be here. My name's Summer. My pronouns are she, her. I've been with Planned Parenthood for about 6 years now, a health educator, educate folks in the community, and I'm excited to offer the education department perspective about birth control today.
Wonderful. And last but not least, Oliver is a part of our LIGHT program. That's Leaders Igniting a Generation of Healthy Teens. Welcome, Oliver.
Hi, I'm also my dog, as you can see. I'm over, you see him. It's my first year at the LIGHT program. I'm excited to share a younger perspective on birth control.
Great. And so, we chose to talk about birth control because it is something that is so important to have access to in our state. And not only just for preventing pregnancy, but also preventing STIs. Many people use contraception for other reasons as well. So I guess we'll get into that a little bit first before we jump into, what is birth control? What's hormonal versus non-hormonal birth control? Can we talk a little bit, Rachel, about all the reasons why someone might want to think of using birth control or contraception?
Sure. A lot of people think birth control is, like you said, just for protection of pregnancy, but there's many benefits to it. Some of those benefits include mood disorders that come along with your period. So mood swings, it can help a lot with PMS, can help with acne. It can help with preventing low iron in your blood so you don't feel so tired during your period. It can also help prevent cysts. Some of us are very blessed and can get formations in our breast or uterus. That can be painful around the time of our period, and birth control can actually help shrink or stop the formation of those. So there's many benefits to it that can help with other symptoms that most people don't think about besides preventing pregnancy. And those are just a few.
Yeah, I'm curious, Summer and Oliver, what are some of the things you hear from youth and teens that may be considering why they'd want to go on birth control aside from preventing pregnancy or sexually transmitted infections?
Yeah, absolutely. A lot of my friends have taken it for things such as marriage. I myself have very severe period pain, and that's why I take it. I have friends who take it for hormonal acne reasons, a lot of different things, but a lot of pain management, acne reasons, and just straight up pregnancy protection.
And so we get into that topic of not all birth control is created equal, right? We have what's called hormonal and non-hormonal, and it's based on what your needs are, your lifestyle, what your health history is like. So Rachel, if you want to just kind of walk us through a little bit on what is hormonal and versus non-hormonal.
Sure, absolutely. So yeah, I think it definitely depends on the person's needs and what they're looking for. There's pros and cons to both. Hormonal, like Oliver said, it can help with heavy periods. It could also reduce risk of certain cancers. And a lot of young people are concerned about pregnancy. They want to establish careers and a life, and that helps prevent it. The cons of it, there's a little bit more side effects with hormones. Although we produce it within our body, there can be side effects. So knowing what those risks are, whether it is depression or whether it is blood clots, although very, 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 very low risk. Some people are very concerned about that, and they want something that maybe is free or hormone free. So that's where the non-hormonal comes into play. And I think that's a great field to look at. A lot of people are concerned about hormones and what it will do to their body. And there's many new methods now. It's just not the IUD. Which is long-term. So that's also very nice if you're young, because that lasts for 12 years. So you can put it and kind of forget it. But there's gels now, and there are also cups that you can use. But there's risk with those because of those methods and where they are inserted. There's risk of infections like urinary tract infections, or because they're long-term and hormone-free, they can be more expensive because it might not be covered by insurance. And it requires very consistent use, where sometimes other hormonal birth control doesn't require daily use like some of the non-hormonal ones.
Let's talk about that for a second, because that's something that I feel we started to hear more about, hormonal versus non-hormonal in the last couple years, right? I mean, I remember when I started using birth control in my early 20s, I didn't even think about that. I didn't even know there was a difference. I didn't know I could choose, whether I did non-hormonal or hormonal. So I, of course, I went to the most popular form of contraception, the pill, right? Very common. And I didn't realize that around the time that I was going to get my period every month, I would get these crazy headaches, right? Because you were going through those, the last pills of the pack that are the non-hormones one, right? And so that's when I started to get these effects. Have you heard from people, Rachel, Oliver, Summer, that's something that they also feel over a long period of time of using a type of birth control, they'll get like withdrawal headaches or things like that?
Yeah, definitely. I started with the pill as well, and I definitely got a lot of weird side effects from the pill, and I wasn't off of it very easily. I had body withdrawal. I had more severe symptoms. I had longer lasting periods. I mean, I had a period up to a month. That's something that is definitely like an individualized thing. With side effects, we never know how one person's body is going to react. All my friends have different things. And people told me that I'm going to gain a lot of weight or lose a lot of weight on a certain thing, and then I don't. Or people tell me that I'm going to have this or something else. I'm currently on a shot that's I'm always on birth control. And that also has different side effects. There's also adjustment periods. I think definitely it's a matter of like informed consent and figuring out like what works for you, what side effects there are, and letting your body kind of adjust and knowing like what works for you and what doesn't. Programs such as the Light program comes into play where we're able to talk to people about these different things and have like a more informed conversation about different forms of birth control, whether that's hormonal or non-hormonal.
Yeah, I just want to touch a little bit on that. Education is such a huge part. Like all of you, I started on the pill too for really painful, heavy periods when I was like 16. I didn't know about any other options. No options were ever offered to me. Thankfully, times have changed and there are more options, or it's more spoken about now. And it's true. Like I always tell my patients that it's kind of like a game of roulette. It's finding out which method works right for you. And just because your friend reacted one way doesn't mean you'll react that way. There is patterns that show that you may react to birth control the same way that your family did, like your sister, your mom, your aunt. Potentially that can be true. But it's true, everyone's body is different, and I think it's finding what works best for you, and sometimes you have to switch methods to see what works right. But our goal is to always help and never harm, and I think it's really important just to promote the different types that are out there. And just because your friend is on one method doesn't mean you need to be on that exact same pill or that exact same method of birth control that they're on. So don't ever be shy to ask and what works well for you. And withdrawal symptoms are real. The longer you're on the birth control, sometimes it can become less effective in regards to symptoms of your period, not protection. And also, those are sugar pills usually in the last year of birth control. So there are no hormones controlling that. So you're having this surge and menstrual side effects, which is what we want to get rid of or reduce for you.
I'd like to add to that too, that just because like you got side effects from one certain type of birth control pill doesn't mean that all the pills are going to do the same. All brands are going to do the same. So definitely like try out what works for you.
My main thing too, we're talking about doctors, we're talking about the options, but she never really told me about other options. I was just put on the pill straight up when I was 14, and where I kind of learned about different forms was conversations with my friends and my peers. I think that's where like we talk about education, peer education was really important because that's the only way I learned Depo-Provera existed. Especially young people don't get really shown other options and just kind of get put on the pill and told go ahead, despite their symptoms being different. There's not really much of an individualized look in my experience, and a lot of that individualization comes from just openly. And I think it's really important to make it less of a taboo subject and be able to talk about birth control like we are now and talk about these different options because I didn't know they existed.
Yeah, 100%. And I'm glad we're bringing this up too. What you mentioned about the Depo shot. I took the Depo shot for a certain time after I had my son because I was breastfeeding and didn't want to interfere with my supply. So I was taking the shot and it was effective. But I remember my doctor telling me like, this doesn't start working right away. So you need to be careful because it does take some for it to be effective. So, and I'd love us to talk a little bit about that, and knowing that not all, I think there's a misconception out there that if you start birth control, like, oh, it starts working right away, but it doesn't. It takes time. And it also, if you miss one pill, you could also, or miss one dose, you could also change the effectiveness of it.
Yeah.
I missed my last dose, and it basically, I'm having to restart that entire adjustment period all over again because I missed 3 months of it. I haven't gotten it in 3 months. And for me, when I started Depo-Provera, which is like very long lasting, you take it every 3 months. I did not immediately stop my period. I had worse symptoms at first. And I was very worried because my body was adjusting to a different hormonal period. I was having period symptoms. I never got mood swings. I'd get a lot of pain, never got mood swings. Start Depo, I got mood swings. It's just all about, and then it went away after my period stopped completely. But it's that there's an adjustment period that isn't talked about that much of
Yeah.
it's going to take your body a second to adjust and have the symptoms you're looking for and have that relief you're looking for. It just takes a while.
Yeah, that's a great point. A lot of people aren't aware of that. In the first 2 to 3 months, I mean, it could be a whole whirlwind of emotions on your body. You can have like the heavier periods, the nausea, the breast tenderness, acne that you didn't have before. And it's correct. Your body does have to try to adjust. And depending on the method that you're starting, there may be different lengths of adjustments, like the Depo. It can take longer for the bleeding patterns and that to adjust. Same with the arm implant. So I think opening up that conversation like Light does, or we do through our Healthy Teens program in clinic, is very important. So people are aware of that. Otherwise, you get scared. You don't know what's happening to your body, and you went on this to help you, not to harm you. And you're concerned that that's going to be the case, right? But it's not. And also people think that if you start birth control, you're instantly protected. I can't get pregnant. Well, guess what? You can get pregnant. You can actually still get pregnant even if you take it perfectly. So I think this is a topic that needs to be like widely discussed, and thank God there's social media these days, right? It's really helped spread a lot of knowledge that doesn't occur anymore.
I wanted to ask Rachel actually, because I used to work in the clinic as a medical assistant, but it's been some time. And one thing we would tell folks if they would contact us and they had just gotten on birth control and they didn't like the side effects. Obviously, if it's, making it where they can't live their life, come in and let's talk about a different one, right? But if it's something manageable, we would, if I remember correctly, LARCs, long acting reversible contraception, we wanted them to try to give it like 6 months and the other one's 3 months. And I'm just curious if that is still the recommendation.
Yeah, I always say for exactly what you're saying, 3 to 6 months for the long acting methods like the shot, the IUD, the arm implant, and the pills, the patch, the ring. I always say about 2 to 3 months. Going into that 4th month, if there's no change, please don't torture yourself. And always, like you said, come in sooner. Like if you aren't okay with it, that's not our goal. We want you to be okay with it. We wanted to help you. So yeah, that has not, thankfully, that hasn't changed.
Right. Okay. Thank you.
Yeah.
I wanted to touch on emergency contraception for a second, right? Because I feel like that's something that's not talked about enough too, and what its purpose is. Some people use emergency contraception as a form of birth control, like long acting birth control, and it's not. So let's talk about that. How do you hear in your groups about EC? We call emergency contraception EC. Are people using this as, how it's intended? Okay, there was an accident. You're not sure if your birth control worked. You take this as a backup, or are people using this as a form of birth control?
I've had to provide Plan B to people before. It's just a thing with emergency contraception, Plan B and things you're taking a few days after. One problem is they're really expensive, and a lot of people are not able to just go get them, or go as a kid, you don't want to go to the store and have to go to the pharmacy and have to buy that in front of people or risk being seen by people. The Healthy Teens program, which I believe provides free emergency contraception to teens, which is really, really, really important, because if you just can't afford to go get that, you risk having no ability to prevent a pregnancy or to make sure that you are on that pill.
And I think a lot of people take it as birth control too. They think that it's better to take that one pill than it is to take a pill every single day, or to put hormones in your body on a consistent basis, which actually it could be the opposite because you can have more severe side effects. Emergency contraception is great, but there's guidelines to it. There's weight restrictions. You have to take it within a certain time, and there's many different forms. Accessibility is a big thing. Insurance doesn't typically cover it unless it's prescription based, like Ella, which is the stronger one where the effectiveness doesn't change. And typically that has to be ordered at pharmacies. So you may not even get it within the time frame that you need it. The Healthy Teens program is great for young kids. Yeah, they did change the laws where it is accessible, but that's embarrassing. A lot of people don't even want to buy tampons or condoms. So imagine going up to the pharmacist asking for emergency contraceptive. I'd probably turn as red as a tomato. But and even at my age, and I'm old, but I won't age myself, but I'm old. So we'll put that out there. I would still, so there's that stigma. And I think it's kind of like accessibility is a big thing. And so we do with Healthy Teens, they get all those services for free. And we also have prevention packs, which brings that cost down from $40 to $20, which is still expensive, but a lot more attainable than $40 for everybody.
You're
It's
getting
true.
for $20, you're getting emergency contraception, you're getting condoms, you're getting lube, you're getting a pregnancy test. So you're getting a lot of things for the prevention packs. You can walk into our health centers and pick one of those up at the front desk there. But I'm glad we're talking about emergency contraception because a lot of people don't know enough about it. Anything else that you hear, Summer, even things in your circles or when you're out with the youth, anything else you hear about emergency contraception?
I guess the big one is that it would have like adverse effects on folks' fertility, which is also a myth with birth control in general, right? So just kind of dispelling that myth that it is effective and safe way to use emergency contraception.
That's good. And I'm glad you said that because that brings us to, all the myths and misconceptions there are out there about birth control, right? And you mentioned the first one, Oliver, that birth control makes you gain weight. You mentioned it a little earlier. Is that true or is that false? Like, do some birth control methods make you gain weight? Yes or no, Rachel?
I think we need the cap game, right? Like that.
Right.
That is false, actually. So that is the biggest one that I probably hear, and Oliver, probably with all your friends. That is a big thing. People are so concerned about weight gain. Oh my God, I don't want to gain any weight. Okay, that is hit or miss. The only two methods that actually have weight gain as listed side effects are the depot shot and the arm implant. And even on those, we don't know if you're going to gain weight, and if you do, how much. Some people actually lose weight. So like Oliver brought up earlier, everybody reacts differently. So we don't know if you will gain weight or if you won't. But in general, I think hormones can increase your appetite. So if you notice your hand to mouth, we want to be mindful of that, right? But as far as methods causing weight gain, the only two that have it listed are the arm implant and the depot shot.
And I'm glad you mentioned the fact that like the fluctuation in your hormones alone can open up your appetite. So it's not necessarily that the birth control is making you gain weight. It's just your body's adjusting. You may have a, better appetite and, snacking, around your period time, maybe ice cream, Snickers, all those things.
Yeah. And I use it as an excuse. Like, let's be real. I like that. I'm like, oh, it's my period. Let me have a Reese's. Like, I may not really need it, but I want it.
Drink. Okay. So this is interesting because I'm glad we're talking about this. I always crave chocolate around my period, like just have anything. I don't discriminate. Any type of chocolate's great. Is that a thing? Like, do you actually get cravings around your period time, or is that a myth?
I feel like it's hit or miss myth. I feel like it depends on the person and their hormones. For me, it's an excuse. I don't necessarily like crave it. I'm just like, oh, it's my period. I can have an excuse to have chocolate, but in some people, cravings are real. It depends how your body reacts to your hormones. Some people have cravings. Some people get headaches, like you said. Some people get tired. So it varies from person to person.
Yeah, that's totally
my
makes
stomach
sense.
will hurt my period, so I don't get hungry.
Oh, wow.
I'm like, yeah. Just like,
I wish I had that.
I don't know. I think with symptoms in general, or like when you talk about like side effects, it's varies so much person to person. I think it's just like some of the things are like, this is what it should feel like, but it doesn't for everyone because everyone's bodies are very, very different. And periods are all very, very different in length and time and severity. So it's definitely like differently.
I think that's in education. That's like our main purpose is to give folks the information. but nothing can compare to you chatting with your provider about it. I also point folks, Planned Parenthood has a great birth control quiz online. Just type in Planned Parenthood birth control quiz. And that can be a starting point. It'll ask questions that are things that are important to you and what you're looking for. But take that information into the office with your provider and then go from there. Because you might hear this from your cousin or that from your friends. And we can provide that education too, right, Oliver? But it's just a starting point for that conversation to have in the office with the provider.
Awesome. And that brings us to our another myth, which I think we already touched on, right? All birth control is hormonal. That is false.
That is
right?
false.
And Rachel, can you name some of the methods that are not hormonal types of birth control?
Sure, yeah. There's Paragard, which is probably the most well-known one, which is the copper IUD. So that is a long-acting method that can be placed for up to 12 years and come out anytime prior. There are some side effects with it, right? Like always. So the copper with your body can actually increase your bleeding and cramps. But again, that may not happen. When I had it, I didn't have that side effect. So just stating again that everyone doesn't fit into the same box. So you may react different than somebody else. So keep that in mind. Don't let it stop you from trying something. It's reversible, so it can always be removed and symptoms go back to what they were prior. Kaya is another great method that's not really talked about. It's a one size fits most cup. It's almost like a diva cup, but you put it in before sex 2 hours prior with like a special spermicide, which is a mechanism that helps prevent pregnancy. And you can leave it in for up to 24 hours, and that can be washed in your dishwasher and reused for a few years. That may not be the best for younger generations. They're more spontaneous. So there's Phexxi, which is brand new. So Phexxi is pretty great too. The effectiveness level, I believe, is around in the 90s. I believe it's like 97%. You have to go on their website for like the exact number. But if I remember correctly, that's where it's at. And that's like almost like if you've ever had Monistat before, or you insert lube inside of you. It's a mechanism like that. So you push an insert inside of you, and it works for up to an hour. And but the downside with that is if you have a history of urinary tract infections or vaginal infections, that can make it worse. But that's hormone free and it's on demand. So that's also a really wonderful method, especially for younger people who don't want hormones. You can carry it with you and insert it as needed. So just as easy as a condom, I think. But I could be wrong because it's everyone's own perspective.
Another form of contraception that's non-hormonal, condoms, right? Also protect against STIs. So that's great. And then there's the progestin only. I wanted to chat about that a little bit too, because I know that that's an option.
Yeah. So progestin only comes in. Oliver's on that. So how about you talk about that?
Okay.
Oh, sorry. I don't know much about it, but I know that it is a really good option for people who have risk of blood clots, because we talked about that, like the thing that side effect of blood clots earlier. A friend of mine has a blood thinning disorder. Definitely can help with like avoiding blood clots.
Yeah.
Because I know if you get like migraines with aura or something similar, you can't take an estrogen pill.
Yep. It increases your risk of blood clots. That's a great point. Yep. So medical plays a big role in what we choose as well, not just what you're looking for, but also to keep you safe.
Great. All right. So next myth, birth control can prevent STIs or STDs.
Condoms.
Condoms are the only form of control that can protect against STIs.
Exactly. When I educate and we go through all the various ones, every now and then I do a knowledge check after so many minutes, which ones can prevent both. So the young folks definitely understand only those. And there's different types, internal and external, different things to choose from. So
what about films? I don't think we talked about that, but that's also a non-hormonal method, right? VCF films. They're like Listerine strips that you kind of place inside of you and they dissolve, and those create a barrier, right?
So not a dental dam. You're talking about something else. Not a dental dam for oral sex. You're talking about something else?
Yeah, it's called a VCF film. So it's called a vaginal contraceptive film. Does anyone still have you heard of anyone still using those?
I have not even heard of that.
Oh,
please educate me.
Yes.
Wait, is this a generational thing? Oliver, have you heard of this before?
No.
Okay, so it's called VCF.
I didn't know of internal condoms existing until now.
Yeah, so VCFs are that's the abbreviation, right? But it's called vaginal contraceptive films. And they used to give it with like, I think it's called F2 or female condoms at the health department. So they may still have it. But it is like almost like a Listerine strip. You put it inside and it dissolves and it creates a barrier. It's like almost like a spermicide, I would say, is the best correlation that I can give for that. It's pretty neat. Look it up.
Okay,
I
we'll
will.
do.
Thank you, Rachel. Yeah.
Next myth, birth control makes you infertile. So we talked about that, whether birth control messes with your fertility or not. What's the verdict out on that?
Myth. That is false. You can get pregnant on the pill. So like you guys said earlier, if you're late on the pill, even by an hour and 1 minute, you can get pregnant. No method's 100%. So even if you do it perfectly, there's still a 1% chance. So your birth, the depo is the only one I think that can take longer.
I think that's where the misconception is. It's not that it messes with your fertility or that it makes you infertile. It's that you might take longer to ovulate again the next time, like on the depot shot. I remember after I didn't know about this. I probably should have done much more research because I was much older in life when I started the depot shot. But it took me a really long time for my period to regulate after that. It was like 10 months, almost a year for it to regulate. And I only did the shot like 3 times. So definitely something to look into, especially if you like eventually want to have a child or, what that looks like for you, just knowing what the window is to have ovulation return to normal.
Can I ask a question actually on shots and long acting? I know that I've been told go for more than 3 years because you risk like osteoporosis and like bone density problems. Could you touch on that?
Yeah, so it used to be listed. Okay, so 2 points. Let's talk about both of those. So the getting your period back and being able to get pregnant during that time can be harder. That was actually never listed until recently. They just updated like patient education handouts, or it was in the fine print, but in regards of what was educated to patients, that's a more recent change. And it can take 9 to 10 months for most people, but again, some people can take up to a year. That's very common. And the bone usage. That also used to be listed, which is why they recommend like vitamin D and calcium through your diet, getting regular exercise, tobacco, alcohol, all the things that can thin your bones. We're more at risk for that anyways, a thinning of our bones later in life. So really building that up. There's no longer a year restriction, but it is recommended to take a break if you're on it for a long time. Also, the longer you use it, the more the thinning of that bones and those fractures increase, because the bone growth typically usually stops while you're on it.
Yeah, I was told like 3 years and like stop, but I've actually never. I remember I heard about it from Summer during one of our lessons, but I had never heard about vitamin D, like taking vitamin D and taking like things to help supplement. So that was actually really surprising. That's something I'm working on doing because I never heard about that, and I never heard about things to having to manage those hormonal effects, which I feel like is really important to know.
Yeah, it's so important. Yeah. And that brings up such a good point, Oliver, of just like asking questions. And like you said, if you hear something from a friend or, whatever the case is, like, don't be afraid to research or ask questions about it from your provider. I want to ask, because I know we're getting close to time here. What is the most far-reaching myth you've heard about birth control? I want to hear from all of you on this.
I feel like the one that I always hear the most, I think, is the fertility one. But I guess, that it can actually cause cancer. I think that there's a lot of research behind that, and that's very situational. Birth control actually helps prevent certain types of cancer.
I don't know how much of a myth this is because I don't actually hear that much far-reaching stuff, but just the idea of that, like, if you're on birth control, you must be sexually active or you must be taking it because you're having sex.
So many benefits of birth control aside from preventing pregnancy. You're right. There's so many other reasons why people take birth control or use contraception.
So I do want to note that there is no shame in taking it as that is completely fine, no matter. And even if you were like still young, like things happen, and it's rather that you would be safe doing what you're gonna do than not be safe at all. And there's no shame in being sexually active, and we're sex positive here, right?
I think also some people might think that they're 100% effective, and even though they're wildly effective, right? Especially when we talk about IUDs and implants, like over 99%. The little thing called human error always can kick in depending on what types people are taking. Like we mentioned, if you're late with your pills, and the only 100% method, if people are concerned about pregnancy, would be to abstain from sexual activity. But birth control is also crazy effective. So,
and if you want to learn more about
'Cause-
Healthy Teens, you can go to our website, ppscnfl.org, and check out our Healthy Teens program information on there. Thank you all so much for joining us. This was such a great conversation. I'm really glad that we're talking about birth control. And I want to give a quick plug because we did just start offering vasectomy services at our Jacksonville Health Center and our Golden Glades Health Center in Miami. So obviously that is a decision much later in life that many people might want to make for permanent birth control. It is reversible, but we tell people the truth that those reversible procedures are not always 100% effective. And yeah, so if you're thinking about vasectomy, you should be serious about it. But yeah, I wanted to mention that as well. And really, thank you all so much for your time. This was a great first podcast. We're really excited about, what is in store for this entire, season of podcasts. And have a wonderful rest of your day.